Hello and welcome. My name is Dr. Abby Mutai. Have you recently been diagnosed with a thyroid nodule? If that's the case, or if you would just like to learn about them, then you've come to the right place. Today, we're going to talk about the thyroid nodule. We're going to talk about what thyroid nodules are, why they matter, how they're diagnosed, and how they are treated. I'll also summarize the discussion by highlighting the key points to take home. Before we discuss about the thyroid nodule, let's first talk a bit about the thyroid gland. The thyroid gland is a small organ located at the front part of your neck. As you can see in the image shown, it is shaped a little or perhaps a lot like a butterfly. The parts that look similar to the butterfly's wings are called lobes. Therefore, the thyroid gland has two lobes, the left lobe and the right lobe. The middle part that connects the two lobes is known as the isthmus. Though small, the thyroid gland is important for various functions in the body, such as regulating your energy levels, regulating your metabolism, and even your mood. With that background, we can now go on to define the thyroid nodule. Now, it's understandable to feel concerned when you hear the word nodule, but not to worry. I'm here to help us break this term down. A thyroid nodule is a lump within the thyroid gland arising from an abnormal growth of thyroid tissue. This abnormal growth can either be cancerous or it could be benign, meaning not cancerous. Fortunately, majority of thyroid nodules are neither cancerous nor do they cause any symptoms. So how does it feel like to have a thyroid nodule? Some thyroid nodules become large in size, resulting in a noticeable lump in the neck. They can also cause some discomfort in the neck or jaw, or cause hoarseness of the voice. If a nodule is very large, one may experience difficulty in breathing if the windpipe is compressed, and pain or difficulty in swallowing if the food pipe is compressed. In some cases, the nodule may affect how thyroid hormones are produced. If excess of the hormones are produced, you may experience symptoms such as difficulty in sleeping, loss of weight, increase in appetite, palpitations, anxiety, diarrhea, or if you're a woman, you may experience changes in your menstrual cycle. A thyroid nodule can also cause underproduction of the hormones, resulting in symptoms such as excessive fatigue, numbness and tingling, weight gain, dry skin and brittle hair, constipation, depression, or abnormal menstrual cycle in women. So what causes the thyroid nodule to develop? Most thyroid nodules do not have a known cause. As earlier mentioned, some thyroid nodules are cancerous while others are not cancerous. Some of the non-cancerous causes are such as 1. Benign tumors like the colloid adenoma. Some nodules also occur in association with autoimmune diseases such as Hashimoto's thyroiditis, or it could be a benign cystic formation. Certain factors have been identified to increase your risk of forming a thyroid nodule. These are such as smoking, obesity, alcohol consumption, the presence of uterine fibroids, or a history of exposure to ionizing radiation. So how do doctors find thyroid nodules? They start by performing a physical examination. They will look and feel for any lumps in your neck. This physical exam technique is called palpation. Do note that some nodules are very small and cannot be felt on palpation. However, if a nodule is suspected, your doctor will recommend further testing. Some of these tests include 1. Conducting a blood test to assess your thyroid hormone levels. Remember, some nodules will affect how these hormones are produced, so it's important to check what our baseline function is. They will also likely request for a thyroid ultrasound scan to identify the specific characteristics of the nodule. These features are such as its size, shape, margin, and its components. Your doctor may also decide to order for a radionuclide scan if indicated. You might also need to undergo a test referred to as fine needle aspiration cytology. This is a procedure whereby a small sample of tissue is drawn out from the nodule using a thin needle. This is done so as to assess the cells under a microscope. The main reason is to really be able to tell if this nodule is benign or if it is malignant. It's important to mention here that not all nodules require FNA cytology. Your doctor will evaluate specific clinical and imaging findings so as to decide whether an FNA will be required. There are certain criteria that guide this decision. Now that we have learned how to diagnose the thyroid nodule, how do we go about treating it? Now, treatment of the thyroid nodule is dependent on several factors. These factors are such as 1. Whether the nodule is cancerous or non-cancerous, 2. The size of the nodule, and 3. Its effect on the thyroid hormone function. If the nodule is causing either an excess or a reduction in thyroid hormone production, then you may be given medication to help balance that out. If the nodule is very large, resulting in discomfort or difficulty in breathing or swallowing, or if there's suspicion for cancer, surgery may be needed to remove the nodule or even part of the thyroid gland. Nodules can also be destroyed using certain chemicals or using heat through a procedure known as ablation. As a reminder, remember that most small and benign nodules require no specific treatment. Nonetheless, you will need to visit your doctor from time to time as part of monitoring and evaluation. The good news is that most thyroid nodules are not cancerous, and many people live with them without needing any major treatment. Your doctor will work with you to decide on the best way to take care of your specific situation. If you notice a lump in your neck, changes in your voice, pain when swallowing, or any of the other symptoms we discussed earlier, don't hesitate to see your doctor. They will be able to assess and discuss with you whether further testing or treatment is required. Remember, early detection means early treatment, so don't be afraid to go and get a checkup done. As a reminder, keep in mind that in the majority of cases, thyroid nodules are harmless and should not cause alarm. That said, it's important to stay informed. Don't be afraid to visit your doctor in case you notice a lump or any other symptom. With the right knowledge and regular checkups, you can manage your health well. If you have any concerns or questions, be sure to bring them up with your doctor. Remember, they are there to help you understand your health and guide you along every step of the way. Thank you for joining me today. Remember to stay informed, and most importantly, remember to take care of yourself. Until next time, goodbye.